In Africa, many countries are implementing universal health coverage policies to assist poor populations. Some countries, such as Kenya, are ahead of the continent. Others are just creating programs that allow vulnerable populations, particularly in rural areas, to access health care for as low as $1 a month. Augustine, a hypertensive man without the resources to treat himself, goes once a week to a Touaebe hospital in Yaoundé, Cameroon, one of the few hospitals where there is a program to help poor patients.
I joined this program because I can't make ends meet. I am in the informal sector. I cannot afford it. I have a large family of 7 children and 4 grandsons. My means do not allow me to heal myself.
But Cameroon's resources can only support a few patients. Many hundreds are turned away every day.
We have a lot of people that are unable to get drugs, pay for their medication, since there is no subsidies for the medications. Yeah, so we have a lot of people that are they are needy, that need to be given drugs, maybe with compensation, but we are unable because there is no coverage.
In Cameroon, the government and pharmaceutical company Novartis have set up a program to help poor patients to treat non-communicable diseases such as diabetes, hypertension, breast cancer, and chronic respiratory diseases.
This means that there's a strong impact of this program in Cameroon, which is the first country where we launched it. Nigeria follows in Cameroon's footsteps, and we hope to reach at least 5 million people in Nigeria. Many other countries are showing interest, such as Burkina Faso, Ghana, and Côte d'Ivoire. And we hope that every year this program will reach as many people as possible in our regions.
The World Health Organization estimates that more than 110 million people in Africa do not have access to basic health care. In response to this alert, health professionals, non-government organizations, the civil society and the private sector launched a reflection in Kampala, Uganda, on the need for African states to put in place universal health care policies to help low-income populations. Kenya is already one step ahead of the other states.
So Kenya knows we want to achieve universal health coverage. The president wants everybody to have universal health coverage by 2023. But Kenya is now kind of going through the challenges of how do we make sure this happens even when we don't have enough resources. We don't have enough resources because 80% of the population is informal. They are not formally employed, and therefore how do you collect them taxes from them so that you can pay healthcare for them?
The main challenge for countries remains the mobilization of financial resources for the purchase of medicines and their delivery, particularly in remote areas where populations generally do not have access to health care services.